warm welcome to the brand new edition of To The Point. I'm Kriti Mishra. And on today's show, we are joined by Kerala's Health Minister, Mrs. K.K. Shailaja. Madam, welcome to Rajya Sabha Television and thank you so much for joining us from Kerala.
Thank you.
More than 360 cases in Kerala. How is Kerala geared up to tackle this coronavirus outbreak?
Yes, we have already 375 positive cases, but 194 patients were now under treatment. All the others cured and discharged from the hospitals. That's a great victory, you know. The victory is that we planned it earlier and we have very good protocol and standard operating procedure and also guidelines, proper guidelines, etc. One thing. And the beginning itself, we started our preparations and precautions. The first case we got from Wuhan, that is in January 30th. And January 24th onwards, we have a very good control room here in Health Department, Directorate of Health Service. When this novel coronavirus began to spread in China, when it occurred there, at that time itself we start our preparation. No one came to Kerala at that time from Wuhan, China. But we were sure that someone will come because so many Kerala students were studying there in Wuhan University for medicine. They are coming and going often. And we thought that someone will come from there and the virus will come here also. At that time, we started January 24th, we started our state control room and we planned each and everything. And we passed the message to all our 14 districts that some new virus is there in China. Sometime it will come here also. Be alert and form a district control room in district level also. And we started training of our health workers from doctor to ASHA workers, field staffs, etc. We started our training. We have a previous experience, you know. We had an experience in Nipah virus incidents. At that time, it was totally new for us because we never was familiar with this kind of virus. It is a newly emerging zoonosis. And at that time, we have prepared our this protocol for Nipah virus and some SOP for Nipah virus, and we start working at that time. And that became a success. Only 16 people succumbed to death out of Nipah virus, and from them we didn't allow to transfer this virus to anybody. That is the first thing. 16 people, and that experience is with us. And with that experience, we planned this thing also. In the state control room, we have 18 expert groups. Each and everyone should have to take one duty. We assign duties for them. One group, one team under the leadership of an additional DHS or some higher officials. They should start screening these things, and for screening everything they should do. They should plan, they should do it. And also for contact tracing, for the surveillance, and also for isolation wards, logistic collection, even for mental health, for the counseling, etc. And every day we start our work after a short meeting in control cell, and we communicate with each and all districts. And all the evening we had another meeting. Now we are having another meeting that everyone will come back and they will assemble together and discuss that day's progress or that day's fate. And from that discussion, we finalize something. And that report every day we are giving to medias. Media briefing is another thing. That is responsibility of another group. And that media briefing is very transparent. Whether there is a positive case, we are saying we have a positive case today. Whether all are negative, we are saying all are negative today. Today is a good day and everything is clear. And that method we take this work. And all the district teams become vigilant, and as in a war front, they are fighting against the virus actually. And the other department also, when it become a pandemic, first phase, health department was in the leadership, and when it become pandemic, Honorable Chief Minister lined up all the line departments and give them responsibility, and we shared the duties and responsibilities for the quarantine and also the traveling, whether they are staying in isolation or not, or jumping in the quarantine. The police also examined that, very strict examination, and we put these people inside the house. 80% of the people about that, citizens about that, obey that. They go to self-quarantine and they obey our rules and restrictions. But someone didn't obey. They jumped and they go to the society for funerals or for the marriage functions, and also in the go to the church or mosque to prayer. They went there. That became a panic situation. At that time, really we afraid. We were very fearful thing happened. But we acted well. With the help of local self-government and police, we sent them back to their home and insisted strict quarantine. Otherwise, we will file case against them, charge some case against them, and we will send to jail. We said that you should go to jail, or you should have to undergo such a punishment. And at last, they go to their houses. But inside the house, some people who returned back from these foreign countries. At first, it was Wuhan, but then Italy and UK, from Spain also people returned here, and from Gulf countries, bulk people returned here. A large number of people returned here, and someone obeyed our quarantine guidelines thoroughly. But others, they were inside their home, but they mingled with the relatives in the home, and that is why contact cases occurred. When a man came back from Dubai, or came back from other Gulf countries or UK, they mingled with their family, and family also got it. That is why this number become like this 375 positive happened there.
But
But
ma'am, when Kerala started, I remember it had the highest number of cases in the country, and today, of course, it is below in the state tally. What is one specific lesson or specific suggestion that you want to give to other states battling coronavirus?
yes, we have no other method but only trace them, only to screen them, and if anyone returned from other countries, we should thoroughly watch them. And if any symptoms were there, send them to hospital directly and isolate them and give them best treatment. And if they have no symptoms of any kind of symptoms, don't allow them to move freely, send them back to their home and stay there. If their home there is no facility to stay alone, as not they can't use common bathroom, etc., common toilet, etc., if there is no separate toilet or separate room to stay, please take them in a quarantine place arranged by governments, and they should be there and strictly quarantined. At first days we used the 28 days of quarantine. Then all the other states and WHR are having 14 days, and we said that 14 days for commonly for 14 days, but if it is a high risk case, they should undergo 28 days quarantine. Very risk contact of the or close contact of positive cases, they should have to undergo 28 days quarantine, and we are watching. That is the most important thing. And the people who were admitted in the hospital, we should examine them thoroughly. Not only one doctor, but we constitute each and every medical college a medical board. With the advice of that medical board, we are treating them. That is the method, and our experience is that a 93-year-old man and 88-year-old lady, they recovered,
Yes,
they cured their illness, and they recovered from the illness and they went back home happily. That is a great thing because the people above, human beings above the 60 or 65 above is most vulnerable. And also people who have comorbidities, they also become vulnerable. And we tried best to keep them away from this contact. Old age people and this comorbidity who have comorbidity, we are trying our best to keeping them away from these foreign cases who return from foreign.
Ma'am, touchwood for
And
the recoveries. We are seeing recoveries, but you've also said that Kerala is ready to combat the second wave of coronavirus. What makes you say
yes,
that?
yes, we should always expect it, a second wave. Singapore, they are reporting that again it is occurring there. And here, now it is receding. The number become 194 today, the positive cases. And today, 36 people cured and discharged from the hospital. That is a good sign. And because of this lockdown, no newcomers are there. People are not coming because no flight service and no train service, etc. All are inside now. Those who returned are under our eyes, and we can watch them. But the problem is that if any people go outside without our notice, they will move around the society and they may transfer this virus to others. This novel coronavirus is such a kind of virus that without any symptom, if a human being is showing no symptoms, but at that time itself, he or she can transfer this virus to other person. That is the most difficulty of this virus. And if any man or woman wandering through the society will supply this virus to other person, we cannot understand. After the 10 or 12 days, they become positive and they have another contact and they also become positive. This will become a chain reaction. That is the community spread. Now in Kerala, there is no community spread. Some clusters are there, family members and relatives, but no community spread. If community spread occur, that will become very difficult
Right.
because the number will surge and we should have to more place in the hospital. But in Kerala, we are always expecting the worst and planning for that. Now we have 1,25,000 beds in hospitals to admit if anyone become positive. We have only now 194 cases with us, but we have 1,25,000 beds. And our honorable CM is insisting that not only that, you should have take other places also. If it become 5 lakhs or 7 lakhs, what shall we do? Then we are finding some places that schools and auditoriums, etc. Under the leadership of district collector and district medical officer, they are looking for some auditorium, some school, etc. If it become a large number, we will arrange beds for them in these huge buildings. That also is our plan C. Plan C is also there. And that's why we are making our preparedness. And not only working with this kind of number, 194 or like that, we are working for more than 1 lakh for that kind of number also.
Ma'am, word over, people are talking about flattening the curve of coronavirus. Do you
Yes.
think Kerala is approaching that stage?
Yes, now we flatten the curve, but we cannot predict tomorrow what happens. If anyone is there in the society without our attendance, there will be a spread, and then a curve will again become high. But we hope that our teamwork and our very good preparedness and planning that will flatten the curve. On the part of this virus, only one thing we can do, that is flattening the curve. We cannot say that virus will not come here, disinfected, and everything is pure. Virus will not come. We cannot say like that because this is a spreading type of virus. This infectivity is very great. This virus. For Nipah virus, infectivity is less. but death rate will be more and mortality rate is more. For this virus, mortality rate is less, but infectivity is huge, a large number. And no goodness for the lower mortality rate, because if it is spread all over the society, the number of death will increase.
Yes.
That is why in America, the death toll go to, I think it is like more than 15,000 or 20,000 like that. We cannot even expect that thing. We are amazing thing that is. It is going on. And we are now in Kerala, we are trying two things. One, to flatten the graph, and second, to reduce the mortality rate. And the curing, etc., saving the people, that is on the other side. But our most important aim is to flatten the curve, and also fatality rate that should become low, and also the old age people and other comorbidity persons, we should have to give more attention and save that persons also. That is our great aim, and we are working hard for that.
But Madam Shailaja, one of the biggest challenges world over right now is to actually save our doctors, nurses, and other paramedical staff. We saw few cases in Kerala. Do we have sufficient protective gear for our doctors, for others in the medical fraternity?
Yes, ours is a small state, and our financial condition is also very low, and this is not very good. And we are trying our best with this situation. In the earlier days, 1957 onwards, when Kerala formed, state formed, onwards, we are trying to have some decentralized planning. We are giving land to each and every person through Land Reform Act. We have very good literacy rate, how we mold our public education system, and also our public health activities also very good, aiming the poor people below. We have primary health centers in each and every panchayat. We have sub-centers for each 5,000 population, and we have community health centers in development blocks, and also in taluks we have taluk hospitals and district hospitals and medical colleges also. But the situation is not so good. We can say that in 2016, when we examined, 67% of the population is going to private hospital for treatment at that time, and out of pocket expenditure is so high, and the staff pattern is a staff pattern of 1961. We cannot think like that. And this government concentrated on creating more posts. 5,500 posts were created in health department for the filling the gap in rural areas, etc. And we converted our primary health center to family health centers. Previously, only one doctor was there, no laboratories, etc. But in a family health center, three doctors, we filled two also, and there were three doctors. And afternoon also, people get outpatient service there, and also laboratory service. In each and every primary health center, we are setting laboratories. Laboratories not for this level 3 BSL 3 type of virus. We can't test them. But they can test whether they are diabetic or not, sugar, blood pressure, etc. They can test the very good laboratories, modern laboratories. And we concentrate on prevention of the disease. And he decentralized several clinics to the primary sector, that Schwarz clinic, who have COPDs. We are examining in the primary health center and giving treatment. I think that also affected, because during this corona season, we examined whether any pneumonia cases is occurring in peripheries or these villages. But it is not increasing. No notable increases in the pneumonia cases. That's a blessing. Otherwise, we have to consider that community spread is occurring. And that kind of previous planning also helped us very much. And the system is not sufficient, We want more human resource, and we want more infrastructure, etc. in Kerala. We are now trying to do it. we decided we have a mission called Ardram mission in health sector, and we are converting all the public hospitals, whether taluka and also district hospitals, to high technology hospitals, developing the infrastructures. We are installing new type of machines. For example, previously we have the old type of X-ray machines. Now we are converting that things to digital X-ray and complete digital X-ray in our system. And also higher level equipments like CT machines, MRI, scanning, etc. And also for cancer, etc. for radiation, we have very good, some cobalt machines are there. And also we are implementing other new types of machines to the equipments to the hospitals, etc. We supplied a large number of new equipments to all the hospitals, but it is not 100%, but we are approaching a very good stage in the sector, public sector. That also helped to tackle this problem, corona incident. We are ready to work, and we have a very good team and very good infrastructure and also very good machines. We have PCR machines, a large number of PCR machines. When we got permission from ICMR, we started testing, the RT-PCR testing in our own institutions. Previously, we have only one. When the corona started, we have only one lab, that is NIV lab, NIV's unit. And now we have 10 labs. We are testing in 10 places. And we have more PCR machines if proper number of these kit extraction, RNA extraction kit and other reagents, if we got more, we can test more samples at a time. Now we tested more than 14,000 samples, out of which 375 become positive. Now we decided to increase the testing. But the problem is, as Kriti said, the major problem is the equipments, personal protection equipments, PPE,
Yes.
and the N95 masks. The scarcity of that thing occurred. And we tried to buy from all places where we get it, and we collected a good number. But it is also not sufficient. Every time, every day when we examine, the PP kit in our stock is for 2 or 3 or 5 days test. That is the major problem. And also this kit is very much necessary to nurses who are working in the isolation wards. And we have to give them. Without proper dress, we are not sending our nurses to the isolation wards. Definitely, their life is more precious to us. Because if they become in peril, then what happens to the patients? No one can attend them. In some countries, even in America, that happened.
Yes.
When the health workers themselves becomes caught this virus, no one is there to attend the poor people. Italy also. At last, Italy declared that after 60, no one should get treatment. That is a pathetic thing, you know. They had to. I am not blaming, but they have to declare like that. What shall we do with such kind of a situation? But that kind of situation, we look to the future, what happens. That is why we are securing, or we are giving protection to our health workers. That is the most important thing. We are protecting them.
Absolutely, ma'am. Completely agree with you. Lastly, Madam Shailaja, what are the challenges that lie ahead?
Yes, we have so many challenges. The first one is that whether the second wave occur or not, we should be aware for that. We can't predict, because that behavior of this virus is like that.
Yes.
Without no symptom, the body or not, human body, human being become carrier of that virus, and human to human transfer occur. So we cannot declare when no positive cases occur today, then we can declare virus, novel coronavirus is gone. We cannot declare like that. We should wait for 2 or 3 months or even year. Scientists are saying even a year we should have to wait what happens? That is the major challenge. And the second thing is, if more people return from other countries, because people are trying to come to Kerala from each and every part of the globe.
Yes.
When the lockdown lifted, they want to come to their own state.
Yes.
We cannot deny them. We cannot send them back. But what is the activities? Thousands of people who have come, they may be carrier of virus. Definitely in Gulf countries and even in America and even in UK, people are dying, and the virus is there, and they will come back. If anyone come back from there, they may be carrier of virus. And what happens? Again, this graph will go up.
Yes.
That's the most difficult thing. Our health work, ASHA workers, they are tired because they are continuously working for 3 months. We are not giving them rest, or they are not taking rest. That is the thing. When we ask them to, if you want to take some leave, you can go, but they are fighters. Our team is like that. They are saying, no, ma'am, we are not going. We are fighting the war, and we will defeat the enemy, and that is our aim. We are not taking leave. Most of the people are saying like that, and they are become actually physically they are becoming tired. And what happens? But we never feel any kind of bad feeling or any disappointment. We are planning again. If thousands of
Absolutely, ma'am.
people come back, they should have to be in strict quarantine.
Yes.
They cannot come back to their home. If there is facility in home isolation and people obey strict isolation, then we can think that they can go to their home. But anyone, any person who are not obeying our isolation principles, they will be sent back to the common quarantine places. In common quarantine places, if the number increases, we can't provide separate rooms. That is the problem. Without providing separate rooms, that is not successful. The quarantine will not become successful. That is the major problem. But anyway, we will quarantine them properly, and strict watching will be there, and they should have to obey all these our protective measures and our guidelines and our principles. And we are getting ready to face that difficult problem. That is the problem.
Right, ma'am, but all the best for your endeavors in this fight against COVID-19. But on that note, thank you so much for joining us, madam, and take care.
Thank you. Thank
Thank
you
you,
for
ma'am.
your
It was a
support.
pleasure talking to you.